have Danielle Tiplady, who recently qualified as a nurse and was one of the leaders in the Bursary or Bus campaign.
Hello everyone, it's really great to be here with you this morning. I'm going to start with, according to the Tories, we have no money for the NHS. But is it not, as Tony Benn said, if we have money to kill people, we have money to help people. Since 2010, the Tories have ripped our NHS to shreds. The Health and Social Care Act in 2012 took away the responsibility of providing health away from Jeremy Hunt, my friend. This act also meant that services go out to tender to the cheapest bidder in our communities and for our hospital services. Many of our hospitals, walk-in centres and community services are run by Virgin, for example, just with an NHS logo. In the last year, the Tories have stepped up their assault on the workforce. So some of you may know I came into the People's Assembly because of the Tories in their autumn statement announcing that they were going to slash the bursaries for nursing, midwifery and associated healthcare professional students. They claim by charging up to £64,000, which is £26 an hour to work, they're going to charge us. This will increase the amount of nurses by 10,000. I think it doesn't take a genius to work out this is not the case. It is also a disgrace. At the same time, they've introduced a new role called the Nurse Associate, who will be trained in the hospital, and nobody knows anything about this role. Not only is this a direct attack on the poor, it is about deterring people and creating a cheaper workforce to sell off. I've now qualified, and this brings a whole new load of challenges and threats. The government have capped our pay since 2010, we've lost 14% of our wages. We've had our post-registration education funding cut by 50%. They've cut safe staffing on the wards, agency staffing. We now have one nurse to 10, 15, 20 patients. We don't have breaks. We don't sometimes even have time to go to the toilet. Chronic underfunding is making our jobs unworkable. A third of nurses want to leave the profession, and we're 24,000 short. This is not isolated. The junior doctors have been fighting an unsafe and unfair contract. This will make them work longer hours, they will be spread more thinly, and they will get paid less. In my hospital, 2 wards have closed already at the threat of imposition because we simply will not have enough doctors. Tired doctors, which they will be, and overworked means that a lot are already sadly leaving, like nurses, the profession that they so love. This is intentional. The Tories want to demoralise, deter and damage our morale so we leave. So the service is unworkable and they can replace it with something better, which to them is a private healthcare system, so their rich friends can line their fat pockets at the expense of human well-being. They want to sell off our NHS piece by piece. It's not only the workforce which has been ravaged. During my time as a student nurse in the hospital, I'd have situations where if a patient came back late after surgery, I'd order them a sandwich costing £18 to the ward, £18 for a dry sandwich. We'd have the linen services which are outsourced, and I go to wash a patient at 6 o'clock in the morning and there's no towels, there's no gowns because it's outsourced and private. We have the transport services are outsourced. I remember once a lady, she's 90 plus years and going home for end of life care. We rang for the transport. On the first day they didn't even bother to turn up to take her home. The second day they did, and we got her on the stretcher, and one of the medications was missing, so the nurse ran off to get the medication, because if we're late and we need to send something in a courier, it costs £80 to the NHS. The transport people, we're going to leave the lady because they only have a 10-minute slot to collect her. They were going to take her off the stretcher and come back another day. This is disgusting. Private healthcare companies base profit over care. This is an utter disgrace. The Tories, shame on you. We cannot let our NHS become this. The doctors have been fighting. It's a terrible shame that the BMA have called off the strikes. This really, really worries me to the bottom of my heart, and please get behind them in whatever they decide to do now. This is why tomorrow is important, and it's important to build a movement, not just rely on the politicians. We need to take charge of this ourselves to defend our services. We need to get involved in our communities, we need to defend our local hospitals, we need to defend the workforce. Dark days loom in our NHS, and we must unite as a movement to fight the Tories and their wicked cuts to our NHS and push for renationalisation before it is too late. Now, something very exciting, I think, has happened in the last couple of days for nursing. The Royal College of Nursing, who are typically an apolitical union, have taken a stand and they have launched a campaign called Scrap the Cap, and they are demanding an end to the pay restraint for nursing, midwifery and all of the Agenda for Change staff in the hospital. They have said, nurses, get your banners at the ready, we are taking to the streets next year. And they have also said, and the General Secretary also said she will back whatever action we want to take next year. This is a first for the RCN and I am so proud of them. People say that nurses won't do this union won't do this won't do this, they aren't political. Well actually, if you say that, risks in itself becoming a self-fulfilling prophecy. We must get behind the nurses, we must empower them, we simply cannot take this anymore. So I say to you to finish, Jeremy Hunt, the nurses are coming for you, and let's save our NHS.